Hello, and welcome to my presentation looking at panic disorder through the lens of emotional and motivational factors. Firstly, let's take a look at what panic disorder is. This is a disorder that the DSM-5 TR defines as a repeat experience of sudden and unexpected or expected panic attacks, where a panic attack is the experience of intense fear with a minimum of at least 4 of the noted physical symptoms: increase in heart rate, sweating, shaking or tremors, shortness of breath, feeling like one is choking, chest pain, nausea, dizziness, excessively feeling hot or cold, and physical numbness or tingling. With panic disorder, there's also intense worry and anxiety about experiencing a panic attack again in the future that results in behavior that impairs one's functioning. For example, one might avoid going to the grocery store for fear of a panic attack. Thus, we can see that panic disorder involves both psychological and physiological processes. And, as Lee et al. Explained, this is a disorder of the fear network. The experience of panic is different from other anxiety disorders in that most of the symptoms are somatic, and thus there is a significant physiological component to this disorder. The physical symptoms experienced with panic are a result of an activation of the autonomic nervous system. Research on panic has also identified hypersensitivity to interoceptive processing, or one's awareness of their internal physiological state, to additionally contribute. When a person is more attuned and aware of their body sensations, they may more readily notice an increase in heart rate and can interpret this as the beginning of a panic, setting off the cascading physiology of a fear response. Whereas if one is not as aware of their heart rate, this is less likely to happen. As we've learned, the autonomic nervous system plays a key role in panic. So let's look at the system in a bit more detail. There are 2 branches of the autonomic nervous system. The parasympathetic nervous system, often referred to as our rest and digest nervous system, activates processes related to digestion and calming of our body. The other branch, the sympathetic nervous system, often referred to as our arousal system, activates body processes to prepare for physical action, such as increasing heart rate, breathing rate, getting the body to send oxygen and energy, such as glucose, to the brain and limbs. Both the sympathetic and parasympathetic nervous systems are always active, yet one or the other will be dominant depending on the situation. Therefore, as you can guess, the experience of fear will heighten the sympathetic nervous system to be the dominant physiological response. The result will be racing heart rate, increased rate of breathing, sometimes to the point of hyperventilating, sweating, shaking, while the parasympathetic nervous system takes a back seat. Research has found that for people with panic disorder, their sympathetic nervous system tends to be more reactive and sensitive to stress, thus more quickly and easily activated than those without panic disorder. This graphic here illustrates the cycle of a panic attack, where noticing a physical sensation, such as your heart beating faster, is interpreted as something bad happening and triggers fear, which then increases vigilance for sensations within one's body, noticing heart racing even more, breathing quickly, trembling. This scary experience amps up to an intensity that quickly activates the sympathetic nervous system, which then further perpetuates and intensifies this cycle. So what is the reason for the activation of the sympathetic nervous system? It actually serves an important function to increase heart rate, to pump increased blood supply, carrying oxygen and glucose for energy to the brain, arms, and legs in order to fuel the body for protective action. This is the activation of the fight, flight, freeze response. and communication within the body to coordinate this response relies on certain neurotransmitters and hormones. Taking a closer look at the physiology of panic, there are a variety of neurotransmitters and hormones that play a key role. For example, norepinephrine, also referred to as noradrenaline, and epinephrine, or called adrenaline as well, are quickly released when stress is experienced. This can be this can be a result of physical or psychological stress. Norepinephrine then acts to trigger the release of corticotropin releasing factor, which is a hormone that activates the sympathetic nervous system, which in turn triggers the release of cortisol, also known as the stress hormone. During panic, corticotropin releasing factor also interacts with a variety of hormones such as glutamate, dopamine, serotonin, and GABA. Let's take a closer look at the fight, flight, freeze stress response. This is a protective reaction that occurs at a physiological level when an individual perceives danger or threat. An interplay of neurotransmitters, hormones, and the brainstem activates the sympathetic nervous system to prepare the body to either fight against, run from, or remain still in the face of perceived danger. This physiological response evolved for survival thousands of years ago to activate humans to survive in a world rife with dangers such as violent physical attacks from animals. In our present-day world, there is less threat of physical attack, yet more psychological stress. This fight, flight, freeze response can be activated by the intensity of psychological stress and absence of emotional safety in our present-day world. This graphic was designed to illustrate the physiological trajectory of panic. When danger is perceived, triggers fear. This activates the amygdala in our brain, which in turn causes the release of norepinephrine and subsequently the release of corticotropin releasing factor, quickly intensifying the sympathetic nervous system activity. Cortisol is then released as a result of the heightened sympathetic activation and acts to prepare the body for action. With a basic understanding of the physiology of panic, let's shift to explore the psychological aspects of this disorder. Panic disorder is often conceptualized as the fear of fear. On a psychological level, there is an interplay of emotional and motivational aspects with panic, where an individual experiences an initial panic attack, essentially an intense fear response, and strong activation of the sympathetic nervous system. This experience is very unpleasant, scary, and somewhat traumatizing, thus resulting in a fear of experiencing another panic attack. This process then creates a conditioned fear response where an individual can become hypervigilant to body sensations and hypersensitive to any slight sensation that could indicate a panic attack may happen. As we saw earlier, this conditioned fear response can significantly contribute to future panic attacks. With panic disorder, there's also motivation to avoid possible triggers. For example, an individual may avoid leaving their house for fear that they may have a panic attack while out. This change in behavior can become very maladaptive and significantly impact a person's ability to function. Looking at what causes panic disorder, there is substantial evidence in the research to indicate genetic and epigenetic causal factors. For example, current data show that panic disorder occurs in 25% of first-degree relatives of individuals with panic disorder. Current research also indicates a 40% rate of heritability. From a genetic perspective, scientists have been able to connect abnormalities in the gene related to corticotropin releasing factor to an increased risk of panic disorder. All of this evidence strongly suggests the existence of a genetic predisposition for panic disorder. At a physiological level, the immune system and neurochemical imbalance have been linked to panic disorder. Research into the role of immune system dysfunction in panic disorder is relatively new, but has discovered some common patterns of immune system dysregulation in individuals with panic disorder. Additionally, in persons with panic disorder, the research has found patterns of either too much of a certain neurochemical or not enough of others. More specifically, imbalances of serotonin, GABA, dopamine, corticotropin releasing factor, and norepinephrine have been connected to panic. The imbalances of such neurotransmitters appears to decrease emotional regulation ability and heighten sensitivity to activation of emotional and sympathetic nervous system reactions. There is also no denying that environmental factors play a causal role in panic disorder. The experience of trauma, especially in childhood, increases the likelihood of developing panic disorder. With repeated trauma, the psychological and physiological fear responses, or fear networks, are activated so frequently that they become hypersensitized and very easily triggered. The research specific to the causation of panic disorder really suggests an interplay of genetic and environmental influences. Not surprisingly, panic disorder is found to be comorbid with a number of other mental health and physical disorders. More specifically, panic disorder most commonly co-occurs with mood disorders such as depression, bipolar disorders, anxiety, as well as substance use disorders. Panic disorder is also associated with a 7-fold increase in risk of suicide. Additionally, higher rates of heart disease and cardiac dysfunction, hypertension, migraines, and asthma are found in individuals with panic disorder. Treatment planning for panic disorder should take the relevant emotional and motivational processes into consideration, along with physiological factors. Crocker et al. Define an emotion to be a symptom of multiple related processes, including relevant thoughts, experiences, and preparation for action, manifesting in physiology, overt behavior, and language. From this definition, we can see an emotion functions to promote adaptation by responding to the pursuit of attainment of individuals' needs, goals, and concerns. Motivation, on the other hand, although similar, is defined by Crocker et al. As the processes that drive goal-directed behavior. If we consider the emotional processes involved in panic disorder, it is clear that fear, anxiety, terror are predominant emotions triggered when danger or threat is perceived. The appraisal of danger triggers the intense physiological activation as well as the psychological reaction to act to protect. For example, if an individual notices their heart is beating fast and interprets this to be a danger, such as, I'm having a heart attack, I'm going to die, the emotional activation of fear and physiological activation of the sympathetic nervous system prepare an individual to take action. Additionally, there are various motivational factors that relate to panic disorder. Firstly, there's the innate drive to survive and protect our well-being. In humans, this creates the motivation and behavioral drive to be aware of threats and to act to avoid or protect against danger. In panic disorder, this motivational process may be hypersensitized to threat. Once an individual has experienced a panic attack, there is also the motivational process to avoid a future panic attack, and individuals may avoid situations or aspects of life in an event to try and avoid future panic attacks. Overall, with panic disorder, there is a general pattern of avoidant behaviors or behavioral inhibition rather than approach and problem-solving behaviors. Taking all these pieces into consideration, panic disorder involves maladaptive and hypersensitized emotional and motivational processes where cognitive biases towards negative information and deficits of executive functioning have been found to play a key role. More specifically, executive functioning deficits specific to attentional biases towards threat, difficulty shifting attention away from threat, difficulty with emotional regulation, and challenges with planning and problem solving appear to contribute to panic disorder. These factors are all essential to understand and consider when developing treatment and intervention plans for patients with panic disorder. The gold standard of treatment that is recommended for individuals with panic disorder is a combination of medication, psychotherapy, education, and specific lifestyle strategies. The research illustrates that patients benefit from a collaborative treatment team of physicians, therapists, lifestyle coaches such as dietitians or nutritionists, physical trainers, as well as social supports such as family and friends. Taking a closer look at medication options, the first line of pharmaceutical treatment for panic disorder are usually antidepressants within the classes of SSRIs or tricyclics. As tricyclics can tend to have more adverse side effects, SSRIs tend to be a physician's first prescription. In addition to antidepressants, benzodiazepines can also be prescribed as an add-on to be used as needed to ease symptoms of panic in the moment. These medications, such as lorazepam, Xanax, clonazepam, can be highly addictive and therefore tend to be prescribed sparingly and their use monitored very closely. Psychotherapy is also effective in supporting the treatment of panic disorder. Evidence-based therapies such as CBT or cognitive behavior therapy have been found to be effective for individuals with panic disorder. Locke et al. Study put forth recommendations for weekly CBT sessions for a minimum of 8 weeks, as this was found to be the most effective frequency. Additionally, mindfulness skills have been found to be effective in treatment. Teaching patients specific skills and strategies such as breath work, emotional regulation, calming strategies provides the ability to stop the progression and ease panic symptoms. In conclusion, there is no doubt that panic disorder, or as Shiota and Kavanagh describe, the experience of extreme anxiety at unpredictable times and places. There's no doubt that it involves an interplay of highly complex physiological and psychological processes. Because of this, treatment requires a combination of medication, therapy, psychoeducation, and lifestyle adjustments to be most effective. I will end with a statement that I find sums up this disorder as succinctly as possible, that we can consider panic disorder as, quote, the fear of fear. And finally, attached are a list of my references. Thank you.